Hello, my name is Tim Murray, President and CEO of the Worcester Regional Chamber of Commerce, and welcome to Chamber Exchange, a TV show. Chamber Exchange, a TV show, is hopefully a conversation that's about economic development, jobs, and companies in Worcester and the Central Mass region. The show is brought to you by our sponsors, Bank Hometown and St. Vincent Hospital. I'm pleased to have with us in our first segment, Jennifer St. Thomas, who's the Senior Vice President of Medicare and Commercial Markets for the Massachusetts General Brigham Health Plan.
Yes,
Jennifer,
mouthful.
welcome. Yes, yeah, well, welcome.
Thank you so much for having me. I really appreciate it.
No.
My role at the plan is really overseeing our employer group business as well as our business that we have for people that are over 65 and on Medicare.
So kind of two segments. So employers of different sizes make choices about the health plan that they'll use.
Exactly.
Hopefully in a way that provides good comprehensive care for their employees and themselves, but also in a cost-effective manner. And that's something you and the team works with companies and decision makers on.
Absolutely. Yeah, so our plan has actually been around for over 40 years, and we were started out of community health centers, and we're really proud to be owned by Mass General Brigham, the provider system, so that we can really bring that clinical excellence to our health plan customers. Most recently, we were also awarded the J.D. Power Award for Member Satisfaction as the top health plan for serving our members. And we rated the highest in health plan that members trust, which meant a lot to all of us that work at the plan.
Right. And so with the, you said the acquisition, and you know, you blink an eye in this constant change and challenges that exist in the healthcare system, providers, insurance, excuse me, at health centers across the board. So with the Mass General acquisition, I assume there's a relationship between the health plan and Mass General, but also as a health plan, probably work with other providers as well.
Absolutely. We have an incredibly extensive network. So not only is Mass General Brigham and all of their hospitals and providers in our network, but our network continues statewide. So we have every major hospital institution in our network. We have every provider group for our employer group business. And so we understand the importance of access, and then we also have a national network to support our members, whether they be traveling, whether they have students that are living elsewhere, or even now with a remote workforce, we can support companies and members wherever they are.
Right. And the other end of the business you had mentioned is Medicare. So people transition as they go on in life, and that's an area that you work in as well.
Yes, absolutely. And our goal there is to really be able to support individuals when they're turning 65, making these important decisions, and really help them from an education standpoint to be able to provide better benefits than they could get with just Medicare alone, to really help support them living their best life and a healthier lifestyle overall.
Yeah, and that's an important, I think, important point to kind of touch on. So you mentioned people at 65 become Medicare eligible, but then there's the ability to buy some additional coverage?
Exactly, yep. So members at that point have an opportunity to buy additional products such as Medicare Advantage, and those are the products that we offer. And we can walk through the variety of different options that we have with folks that are making that decision, and really have a consultative approach to making sure that we're finding the best product that's a fit for them.
So in both of those scores, if there's a company, and companies oftentimes make these decisions annually, some work with a broker, some work directly with the companies. Similarly, individuals. What's that process in which you engage with a company on that end of it, and how do you get that word out or do that education with the Medicare population?
Absolutely. So for our employer-based business, we work with a number of different trusted advisors in the marketplace, and we really rely on those trusted advisors to bring our products to market. Some of the reasons why they like working with us is that our team is local. We actually have a number of different team members that are based here in Worcester. We have really been focused on building out our Worcester market. We believe there's tremendous opportunity here, and that we have products and services that the Worcester community has been asking for. We've been focused on affordability and bringing new products to market. And so one example of that is we've just launched for January 1st for small businesses the ability to have a product that has a lower price here locally, but also access to national coverage, which is called our EPO product. And it's already getting great feedback. We rolled this out to larger companies earlier this year, became instantly our top seller. So we've been able to differentiate ourselves with having new products and services to the market. We've also really listened to our clients and tried to come forward with just common sense solutions. So we know that there's a challenge in terms of mental health access. So we brought forward and augmented our network so that we could really guarantee our members access within 3 business days to the mental health care that they need. We've focused on women's health, really trying to get at some of the conditions that have been more stigmatized to make sure that we're addressing the concerns that people have and that are meaningful to our employer groups. And then on the senior side, we are always looking at our product portfolio, listening to our clients, and we're going to be rolling out some new products for January 1st as well for that space.
Got it. And you mentioned EPO. That's an abbreviation for?
Exclusive Provider Option.
Got it.
We love an acronym in health insurance, so
Healthcare.
always want to get a new one in.
Yes, yeah.
Yeah.
So you mentioned kind of the evolution of the company, started out of the health center in East Boston and some of the different names, and then the Mass General acquisition. And so Mass General Brigham Health Plan, fairly new to the Central Mass market. And you talked about some of the ways in which you're building out the team. But in that period, you've also, some ways you've got involved in the community.
Absolutely. So we just recently sponsored the Canal Diggers Road Race, and we're going to be at the Worcester Business Journal's Outstanding Women in Business next month. We're really committed to this community, making sure that we're being seen in the community, that we're present. And we also have many accounts already here, and we've been developing a really great client group and referenceable accounts. And so as employers are considering their options, we're happy to have them talk to some of our current customers who are really happy with us.
And you mentioned some of those advisors. If there are employers out there, and oftentimes the anniversary dates are kind of the first quarter, or kind of early, end of first quarter, beginning of second quarter. It's not too early for employers to start thinking about that, having that conversation, engaging with advisors or maybe your team directly?
Exactly. Whether it be you have a January 1st renewal, we're happy to be talking to you now. This is certainly the busy season. But even if you have a July 1st renewal, happy to have a conversation, talk about our capabilities. Sometimes it's very busy when you get to your actual renewal season, so we're always open to having the conversation. We come from a place of education where we just want to make sure anyone is educated about our offerings, and we're here to find the right fit. That's most important to us.
And similarly, on the Medicare side, are there ways that people can engage and learn more?
Absolutely. We have a dedicated team of advisors, always available to talk members through any questions that they have and reach out to us.
So we've got about a minute left.
Yeah.
Is there a website, places
Yes.
where someone can go to
Yes.
learn about events or just having
Absolutely.
direct
I would
conversation?
direct everyone to massgeneralbrighamhealthplan.org to find more information and to be able to contact our team.
Great. Well, I ran the Canal Diggers 5K this year, and it was
Such a great race.
Yeah, great event, and that sponsorship helps them give back to the neighborhood and the community and the Canal District. So thank you for that.
Thank you so
and,
much for
thank
having
you for
me.
joining us.
These days, you've got your hands full in life. That's why we help you bank simply and securely with tools like Face ID and Touch ID. It's why we make it easy to make purchases on the go and get cash back while you're at it. Why we help you quickly deposit checks wherever you are. And it's why we lend a hand with sending and receiving money right from your phone. So even when you're on the move, you can manage your finances. Bank Hometown. Unlock your potential.